My name's Angel Medina, and I'm a registered nurse in surgical services, and I'm here today to talk to you about high BMI patients and the importance of notification to the operating room, special procedures, GI, cath lab, and any departments, procedural type departments where the BMI is very important to the positioning and the type of equipment and the staff that we will need. Obesity is an excess of body fat that impairs one's health. Obese patients are those patients who have a body mass index of 30 to 30.9. Morbid obesity is typically defined as being 100 pounds or more over ideal body weight or having a BMI of 40 or higher. Obesity does not just complicate the life of the patient, but also puts those who care for the patient at risk for injury. Staff members often are fearful of being injured, and at the same time, obese patients worry that they pose a risk of injury to the healthcare providers caring for them. The most basic tasks can be very difficult for obese patients, and this can adversely affect their self-esteem. Sitting up, standing, walking, going to the bathroom, taking a shower, and moving from a bed to a chair are all tasks that often require assistance. Caregivers need to have the right facilities and equipment to help these patients in a dignified manner. Key factors in caring for and moving obese patients include the patient's body mass index, type of weight distribution, cognitive ability and ability to bear weight, pain level, endurance, and respiratory status. It has been said that obesity is the last socially acceptable form of prejudice. Most obese patients have experienced a lifetime of prejudice and discrimination. According to a survey done by Ayat et al., nurses self-reported agreement with the belief that obese patients are unsuccessful, overindulgent, lazy, or experience unresolved anger. And with that study, 63% of nurses agreed with the statement that obesity can be prevented by self-control. 48% felt that uncomfortable caring for an obese patient, and 31% would prefer not to care for obese patients. This shows the importance for training and education and ensuring sensitivity while caring for obese patients, as well as how to safely care for the obese patient. Obese patients deserve to receive non-discriminatory, appropriate treatment and care. Sensitivity to the patient's body, image, and consideration for patient as an individual is of vital importance. As with all surgical procedures, the individual needs of the morbidly obese patient must be carefully assessed and conveyed to all members of the perioperative team. Hospital resources including proper beds, chairs, lifts, and transfer devices must be available in the OR, ICU, and radiology suites. Continuity of care requires that personnel in all areas be aware of the patient's needs related to mobility, equipment, weight restrictions, and the need for special equipment. Before the patient is transferred from the preoperative area to the OR, the circulating nurse and scrub person prepare the OR for patient-specific surgery, taking into consideration the individual needs of an obese patient. Some of the considerations would be patient's weight, type of fat distribution, affect patient positioning, and required equipment and instrumentation. The RN assists the anesthesiologist during intubation. You decide, depending on comorbidities, whether if you're going to lay them flat or use a ramp. The RN remains vigilant for changes in the patient's cardiac, respiratory, and vital signs throughout the procedure. Obese patients have little respiratory reserve and can become distressed quite easily and quickly. Always have a difficult intubation cart and a trach kit close by. Preoperatively, you're going to check with the anesthesiologist and be prepared for to give cricoid pressure to prevent aspiration or acid reflux by elevating the patient. An obese patient may suffer from increased or decreased heart rate, decreased voltage on the electrocardiogram as a result of fatty chest, slow conduction, or ischemia. Plan accordingly should you need blood products. Have a crash cart available should you need it. Place SCDs and TEDs on patients to prevent DVTs. Some of the facts. When a patient's BMI exceeds 35, safety risks increase for the patient and the healthcare provider. Obese people require more healthcare than people of average weight. There needs to have to be considered in operating. Their needs have to be considered in the operating rooms, radiology and diagnostic imaging, and the treatment rooms, the equipment used, and the amount of extra staff needed to ensure safety. Not having appropriately sized equipment and supplies for obese patients only adds to the embarrassment of the patient and the staff members and increases the risk of injury to all. When urgent, emergent, or after-hours on-call surgical cases occur, we need to wait as soon as possible. Many of the beds, supplies, equipment have weight capacities. Having a room set up by the OR crew only to find out that the BMI is the patient's morbidly obese with a large BMI reduces the standard of care and forces the patient to have to wait longer while they are already anxious and scared and in pain. Obesity is not a reason to provide substandard care. An estimated 12% of nurses annually leave their profession due to back injuries, and more than 50% complain of chronic back pain. Costs associated with each back injury range between $5,000 to $100,000. Indirect costs, including lost workdays, increase that number. Healthcare industry workers sustain 4.5 times more overexertion injuries than any other type of worker. The National Safety Council reports that a healthcare worker is 41% more likely than the average worker to need time off because of serious occupational injuries or illnesses. Considering the trends towards obesity and the skyrocketing increase in bariatric surgical programs, hospitals must address the special design and equipment needs of obese patients in their short and long-range planning. Surgical Services proposes a new policy to notify departments receiving high BMI patients prior to transfer in order to plan accordingly, safely, and in a timely manner. We propose to start with the ER receiving beds or bed scales that can weigh patients up to an extremely high amount. We're thinking about 1,200 pounds. Notification to on-call departments is critical due to special equipment needs and extra staff for moving help, anesthesia assistance. Working as a team prevents injury to patient, staff, and the organization. The cost of appropriate beds is far less than the costs related to workplace injuries. Any patient with a BMI of 35 or greater, the RN will notify the procedural department or nursing supervisor. If the patient is an emergency case or off hours, the nursing supervisor will call in extra help, your swinger or anesthesia tech, and notify the staff of the BMI. Staff will confirm that the equipment will accommodate the patient's weight. Any special equipment will be pulled out prior to the start of the case. We would also like to add the BMI, height, weight to the preoperative checklist as one of the vital signs. Thank you for your time and consideration in this matter.